Hi, everybody. I'm Dr. Lydia. Okay, let's start off with Carlee and Tiffany kind of telling me what you do, your expertise, what you love treating, kind of where your passions lie.
I'll let you go
All
first,
right.
Tiffany.
Okay. All right. So, hi everyone. I am Tiffany Balin. So I would say I kind of have a little mixed passion. So I really love helping people just optimize their health, where we're kind of preventing chronic illness. I like to call it like personalized medicine. So I really like to kind of live in that realm now where we're just kind of fixing things so things don't go awry later on. And then I do have a soft spot for oncology. And so I spent many years working in oncology as a nurse practitioner. So then I do some integrative oncology stuff as well.
Awesome. All right, Carlee, you go ahead.
So I am a chiropractor. So your nervous system is my utmost importance in our office visits, but I do muscle testing, applied kinesiology, and so we incorporate some of that more functional nutrition into the office visits. I would say like my bread and butter is going to be, I always say women between the ages of 20 and 50. Healthy moms create healthy babies. So I love getting women in early enough where we can support their bodies, get their hormones in a really great place to then help them through pregnancy, postpartum, and then as they head into menopause. So, I use supplements, dietary changes, but like I said, my bread and butter is making sure that the nervous system is regulated to keep every function of the body working smoothly.
Oh, I love that. Okay, well, right off of that into hormones. So our first topic today is going to be basically hormones. So first question for y'all is going to be on the topic of perimenopause. So women in their late 30s and 40s are dealing with irregular periods, mood swings, and brain fog. One of you uses bioidentical hormones, and the other focuses on natural solutions. So I'd like to hear how you both would treat these patients. Give me pros and cons to your treatment methods, and when one would recommend the other.
Okay, you want me to go? Okay.
Sure.
All right. So, okay, so how would I treat this individual? Well, so I always want to take a whole approach and actually understand what's going on with that individual. And so when we're seeing these hormonal shifts, we know that our progesterone is declining as we age, and then our estrogen will start to become erratic and we'll have these highs and these lows, and testosterone will slowly start to decline. So for me, yes, I will use bioidentical hormones, but not alone. So I always want to make sure that people are eating like optimal protein, and I know Carlee will like to say like a blood sugar regulating diet, that we're having enough protein, healthy fats, fiber. I feel like a lot of us really lack fiber, and that fiber is actually what's going to be really important for pulling out some of that excess estrogen that we would call like a xenoestrogen that we can get rid of. And so a lot of us don't get enough fiber, so I tell people to try to shoot for 35 grams. But um, sleep, I'm going to focus on people making sure they're sleeping well, because if we're not sleeping well, then that's impacting stress hormone, that impacts our other hormones. I will make sure eating cruciferous vegetables that helps your body and your liver process and detoxify hormones well. So it's focusing on the liver too, movement, strength training, gut health, like all those things. And then I will support their hormones as they start to shift with bioidentical hormone replacement therapy.
Yeah, and I would, so you'll find moments. So I guess I should preface this a little bit. So I refer people to Tiffany all the time because as a chiropractor in the state of Tennessee, I cannot legally prescribe medications. And so I am not anti-medications. I think there's a time and a place for them. So I actually send my patients over to her if I do think they need some bioidentical hormones. So I did want to say that I'm not against them. But like Tiffany said, I care so much more about like I want everything else to be lined up first before we jump to something like that. So making sure, like you said, motility in the bowels is the number one thing to get any of that excess estrogen out and bring those estrogen symptoms down. Some of those like night sweats, some of the irritability, different things like that. 100% like you said with sleep. Now, if I have a menstruating female, I support their progesterone using natural herbs, usually day 14 through 28 of their cycle. And then I have them take a pause day 1 through 14. So these would be all things that I would try to get them, when they have all the lifestyle things correct, the high protein diet, the high hydration, the strength training, the good sleep, when they have all those things correct, then we can add in some supplements to go, how do I support you? But there is times and places where those supplements are not strong enough to relieve the symptoms. And in our office, we talk a lot about 80-20. If your hormonal change is affecting your life so much, like that is a time and place. If we're talking about mental health, if we're talking about relationships, family, like that I would bring in pharmaceuticals to bring stability into those hormones for those people when we've maxed out everything else correct in the correct way first. So I think that was the biggest thing that I wanted to say when it comes to perimenopause is like it doesn't have to be one or the other. It can be both.
Awesome. Okay, so next question, kind of right off of that. Um, Both of you mentioned testosterone. So this testosterone therapy for women is starting to trend on social media. Is this a good thing? Is this a bad thing? Is it dangerous? When do we consider it? When do we use it? So that felt like a good next question here.
Well, I'm going to start off on that one just from a not so funny story. I had a woman and a husband, a man and woman who were coming into my office, and the individual started to have really aggressive cystic acne and couldn't really figure it out. And so she went to her provider and she asked her provider to do some lab tests, and her testosterone value was in the 1500s. And she was not taking any testosterone, but her husband was. And so for me, I think I'm going to be really, really hesitant with bringing testosterone in. I personally think there's a lot of herbs, there's a lot of supplements. We use two products from Metagenics called His Synergy and Testralin that use some herbal products in it to help women manage some of those testosterone levels. But again, if you are not eating enough protein and you are not using muscle mass building exercise, that testosterone level is always going to be flawed. Um, and then I know I've talked to Tiffany and with some mutual patients of just making sure that we have the fat content in our diet, in our body to actually produce the hormones. All hormones are made from some sort of fat. If our cholesterol is too low, we're going to have a harder time producing those hormones that we need. So I would say I'm more against using pharmaceutical grade testosterone on women, but Tiffany probably has some examples where it was really beneficial.
Um, yeah, so I agree. I agree that so here's the thing. Your body's not going to prioritize making testosterone if stress is a big component in your life also. So we have to look at the whole picture. We have to address what are we doing day to day? And sometimes it's hard to, a lot of the people I see are moms that are taking care of children or they're working and they have these stressful jobs. And so we have to prioritize that sleep and that stress response so your body can actually make these hormones. And to, like Carlee said, we need cholesterol to make these hormones. So I think that that's very important. Now the flip side of that is I will use testosterone in very female appropriate dosing. So um in her response where she had this woman who had this really high testosterone because she was getting it from her husband, that is the reason why I don't really like pellets or other things because they do shoot the levels up really high. I tend to use more topical options, or like a lozenge if needed. And the reason for that is I have found that when used in female appropriate dosing, it can really help mood and provide a sense of well-being for women when they're really struggling. And when they're overwhelmed and overstimulated and all the things going on. It when it's used at very excess levels, we can see that agitation and stuff. That is not what I'm trying to do to people. And it can support bone density, it can support mood, it can support energy, muscle maintenance. So I will use it, but I use it and not without the protein and making sure that we're doing the lifestyle stuff as well.
Tiffany, in the chat, somebody mentioned using hormone replacement therapy post breast cancer, and just saying is this beneficial? Is it harmful? Does it outweigh the risk? Do you have any opinions on that?
Yeah, so that's a good question. So it depends on what kind. I mean, I feel like I could go down a whole rabbit hole on that, but it depends on the type of breast cancer. Is it estrogen receptor positive? Is it progesterone receptor positive? How far are we out from that? What are we doing lifestyle wise to support that? Because a lot of the times in breast cancer, we're using something, if it's an estrogen receptor or progesterone, we're using something to block those hormones. If it's not that, then it's a different conversation. Like, for example, a triple negative breast cancer. Um, so is it women when they go through these cancer diagnosis and they go through chemotherapy and stuff, they're put into like a chemical menopause essentially, and they will get that vaginal dryness, and there'll be things that we can utilize that aren't necessarily hormone therapy. Now vaginal estrogen, we have research to support that that is safe in women that have had breast cancer. Of course, you always want to talk to your provider about the risk versus the benefits. But yes, it is very patient specific, and also not without addressing the whole terrain of the individual. So I'm very big on like what is your terrain? Like what are your genetics showing? Like what is your lifestyle doing? Like we have to look at the whole thing of what caused the cancer to happen in the first place. So we need to fix that, and then we can have another conversation about hormones. But yeah, sorry, that's kind of a long answer.
No, I would
Oh, that
I
was
would
great. Thank you.
I would agree with that. I've had a few recently breast cancer patients who did not have hormone responsive cancer at all. And so much of their treatment that we worked on that with them holistically and with other providers in town was having to do with detox, right? We know toxins like to store in the fat tissue. Breast tissue is fat tissue. Toxins next to a cell can create chaos, right? And so um, I think there is a time and a place where hormone replacement therapy for people from a supportive side who don't have the risk, as long as we know that there is no risk because we're doing the right testing and we're doing all the things that we need to be doing.
Awesome. Okay. Well, thank you both. I'm gonna like switch gears here in the hormone and kind of go the opposite side of ages. So with the whole birth control usage, just we're gonna straight off that. Sorry if you can hear my dog sleeping. So with everybody coming off of the birth control, that's kind of the thing now. Everybody's experiencing these hormone imbalances, symptom being hair loss, acne, irregular cycles. So what's going on here? What's happening to their bodies? How do they fix it? What are the first couple steps they need to focus on?
Yeah, I mean, it's actually, and I don't know if Tiffany, you have this in your practice, but like it's so refreshing to see the amount of 25 to 35-year-olds who are coming into my office and they're like, I want to get off birth control. It's just a great kind of like it's just cool to see people wanting to feel in tune with their body and looking for other options that are out there. Um, I usually always start with detox. Most of the hormonal birth controls that people are on are adding hormones into their body. And so we just want to make sure that all of those detox pathways, so like we said at the beginning, pooping is one of the number one ways to get estrogen out of your body. I want to make sure all your detox pathways, bowel motility, sweating, liver, kidneys, lymphatic system is all moving 100%. And then another one is just like cortisol management. The precursor to cortisol and the precursor to your sex hormones is the same. And so if your dial is constantly pointed at cortisol and you come off of birth control, you aren't going to produce things such as progesterone, estrogen, testosterone in the values we need to see a regular cycle. So chiropractic balances the nervous system, helps calm down that sympathetic response, get you more into parasympathetic. And we've had people with just chiropractic alone who got their cycles back very quickly and regularly post the pill or any sort of hormonal contraceptive.
So yeah, so I'll spin off of that. So what is oral birth control doing? Well, it's like stopping your ovulation, right? And so it's suppressing your body's natural ability to produce hormones. So what happens when you come off of that birth control is your body is trying to produce hormones again. So then we'll see these like irregular cycles. We'll see acne because with these hormonal shifts, we'll get increased sebum production. We'll see mood changes because your body is like trying to produce estrogen or progesterone again. And so that's why like when we come off of it, we'll see some hormonal changes as well. Now, yeah, like supporting the body's ability to kind of detoxify and repair is great. And so I love that you guys focus on that, Carlee. I Birth control can cause nutrient depletions over time, like vitamin B6 and magnesium. And so I will support that and make sure that people are not completely depleted and kind of get them back to where they need to be. I have seen girls' cycles come back within a couple months and become regular. I had a girl recently who hadn't had a cycle in months, and I think it was more holistic picture, like, okay, I came off of birth control, but also I'm being a little too restrictive with my nutrition because we're in this world of social media and the stress of looking a certain all, so there's so many factors. Um but yes, I think fixing the nutrient depletions, supporting, liver detoxification, gut function, protein, nutrition, those are all the things that I would focus on as well.
And then Tiffany, I don't know, do you have a perspective on, in our office, we recommend the Aura Ring to a lot of our patients to help just be able to see an insight. I know basal body temperature isn't 100% accurate, but it can be very beneficial to see where luteal phase starts, where follicular phase starts, those type of things. Do you have any opinions on utilizing that to see cycle regulation and or as a form of birth control?
Yeah, so I mean, if we were in a perfect world, right, would we have everybody doing like natural family planning where they wouldn't need these exogenous hormones and we wouldn't have to use oral contraceptives? And yes, and I think looking at that basal body temperature regulation is very important. And just tracking cycles, right? So we're like, okay, I'm ovulating here. Now, if you have an irregular cycle, that can be a whole nother issue. So I think that that's important. I tell my people because realistically, a lot of people are not going to do that unless they're really extremely motivated. And we see a lot of those in our practice, I think, and motivated individuals. But if we're talking about people outside of that, I tell people if you absolutely need something, I would prefer you to do something that's not going to suppress your body's natural production of hormones. And so like the oral contraceptives do that. IUDs are not my favorite either, but like if we're not going to do the other things where we're looking at the cycle and the ovulation and stuff, then it's an option that doesn't suppress your body's natural hormone production. Still not my favorite. It's a synthetic hormone. But yes, I agree. I wear my Aura ring. I look at things, and I mean, I look at it for lots of different reasons. Maybe it's not feasible for everyone, but I think that that's an important way that you can do it without synthetic hormones.
Sweet. Okay, let's jump into weight loss. So I feel like this goes very hand in hand with the hormones of females, whether they're in their 20s or they're in their 50s. So first question is drug-based. So Carlee, you're going to be more on the natural scale. Tiffany, you're using maybe the GLP-1. So I'm going to give you a case. It's a 40-year-old woman. She wants to lose 40 pounds. She's tried everything. What do you do?
Yeah. Who wants to go first?
You can
Okay.
go.
Okay. So, okay. So 40-year-old woman can't lose the weight. So we start to think about like what could be causing the weight gain, right? So we could be having hormonal shifts at that point. We can have perimenopausal symptoms 8 to 10 years before we actually go through menopause. So we look at your hormones and your ability to detoxify those hormones. And are you getting exogenous hormones from your environment, meaning like fragrance and the products we're using on our skin, and can we minimize that? And so then the other thing I think about is as we get into our 30s and 40s, our basal metabolic rate starts to decline and our muscle mass starts to decline if we're not doing weight training. So that's why it becomes so important to really shift into focusing on weight training, especially in our 30s and 40s. So we're not losing that muscle mass because then that decreases our metabolic rate. So we're going to focus on those things. We're going to look at cortisol, or I mean, we're going to stress. I mean, if the more stressed we are, our body's in fight or flight, we're going to hold on to weight. Is it an environmental toxin that's causing that? Or is it just our psychological, like our stress from our day-to-day life? So we want to look at all of that. Decreased muscle mass over time will decrease insulin sensitivity. So we got to make sure we're eating like a blood sugar balancing diet. Now, will I use a GLP-1? Well, Yeah, I mean, if in the right person, absolutely, I will because your body makes GLP-1 hormone in your small intestines. That can actually there naturally decline as we age as well, but it is there to for say for you to have fullness. So if that declines, then maybe we don't have that sense of fullness as easy. It'll make your cells more insulin receptive. I microdose it a lot in individuals. I do find that we're vastly not using them appropriately. And so that's why I tell people to like make sure you're going to somebody that knows what they're doing with them. Um, but so I would basically work on the lifestyle stuff, optimize any hormonal issues, and then I will use a GLP-1 if needed and if they're a right candidate for it.
Right.
Yeah, I would do a lot of the same. I think the common denominator when it comes to any of this hormonal stuff is insulin resistance, protein regulation. Are you using your protein? How much protein are you consuming? We do use products in our office such as alpha lipoic acid, berberine, um, chromium, bergamot. Some of those like blood sugar regulators are similar, like the natural versions of some of the GLP ones. So we do use those supplements, and that's the beauty of muscle testing is I'm able to muscle test exactly which supplement works and at what dosage it works to create some of those similar effects. So on this woman, I would probably use those things. But if you can't already tell from all the way we answer all these questions, it's like the lifestyle stuff has to be in check. We do Vibrant Labs, and I think Tiffany, you might do as well. And we do the toxin panel, and we check out things such as like glyphosate levels, parabens, phthalates, heavy metal toxicity, mold toxicity. Most of the aging females who are coming in wanting just to get support with weight loss are holding weight around their belly, their midsection, their thighs. Like I said, toxins inside of fat decreases the ability to lose the fat. So if we can really narrow in and figure out what toxins are in there, how do we eliminate those toxins? Um, Balance the blood sugar, get them working out again, get them eating lots of protein, we can see that the 40 pounds will come off. I think the difference in like what we do and what Tiffany does is because everything in our office is nervous system focused, if they are running at high stress levels, the time frame to get the pounds off is usually longer than what the patient wants to hear. If they're coming in with the expectation that they want nervous system care, and that's why they're coming to someone who does muscle testing, not just blood work, they're usually okay with me saying, like, hey, this could take 6 months to a year. If there's someone who's like, my daughter's getting married in October, the stuff we're going to do in office is just going to take time because their body has been in a state of fight or flight for potentially 10, 15, 20 plus years. And it's just going to take time to reverse all those symptoms and get the lifestyle stuff back in check.
And just to kind of spin off on that too, like I tell people to that point, like you didn't get here overnight, so you're not gonna like we can't like repair things overnight either. And so I think that that's important to set the expectations of things don't happen overnight, and so we have to really communicate that with people because I mean, I get it, people want to see things change quickly and some people feel really bad, and so we want to help them. But yes, just setting the expectation and things can take time too.
And I've had patients who I know are doing everything right. They've been working with me for years and they're doing the weight work and they're eating, the high protein diets and they've done the detoxes and they do all the things. And I send them to Tiffany to get support. And some of those patients are on some of the meds and they're crushing it. I mean, I can think of a few off the top of my head, and you probably can too, Tiffany, where I'm like, I trust them because they're doing the work. And so the meds actually filled in at a space where it was really helpful.
Yeah, quite sometimes like to that point, yes, like your people will be doing all the right thing. And like I have people like that too. And just the little microdose of the GLP-1 truly will be just the thing that to lower the inflammation and kind of get the excess weight off. And so it's very individualized, but yeah, that was all I wanted to say on that.
I have a side note. Okay, Tiffany, I do have a question about these GLP-1s. So I've recently seen on social media a influencer who has had success treating her migraines with a microdose of GLP-1. Any thoughts on how that's making a difference?
Yeah, so I have found, okay, so what I have found is that I start like fraction of the dose that like commercial medicine starts at. Because I have found that most people don't need that. They don't need those, even the starting dose of a commercial medication, GLP-1. And what, in my opinion, and it's funny you bring that up because I literally just ordered a whole nother book on just like GLP-1s and how they work. And it's my opinion is that we're using it in autoimmune conditions, we're using it in fatty liver, we're using it in so many other things. Not, I tell people weight loss is just kind of a side effect where I'm using it to repair what's going on at the cellular level. But for that, I think it's more about whole picture. Your body's processing sugar better, that is impacting hormone regulation better. So it's fixing things at the cellular level, and then that can impact migraines. And I've seen it completely reverse fatty liver disease. So there's just lots of different utilizations. I just think they're being grossly overused or misused. And so that's a topic for another day. But I have seen them change people's lives too.
And
Awesome. Thank you for answering that question.
I've had a couple patients too who've done the GLP-1s for weight loss. And like Tiffany, like you're saying, all of their biometrics like get back into order and like they feel great and they actually don't have any weight loss. And it's like, that's when I always have to remind them that I was like, these medications were brought in for healing and then later found that it can create some of these more cosmetic effects. So it's like, if you're someone who literally needs it for a healing mechanism in the body, you might not see the weight loss, and that's okay, but let's look at the biometrics to see what's actually changing and how it's benefiting you elsewhere.
Awesome. Thank you. Okay, switching gears again into gut health. So think IBS, food sensitivities. Right along this, we talked about the small intestine with the GLP-1s. So um, one, we're using the muscle testing to see what's going on with the gut. Another one is using more of like the Vibrant Labs testing like stool. So let's hear on your approaches, kind of what you're seeing in practice, your approaches that are making changes, things like that. Carlee, since you talked last, I'm going to have you go first, and we're going to make that our trade-off.
So if we're talking chiropractic, we're talking you're either in a state of rest, digest, and heal, you're in a state of fight or flight. If we're in a state of fight or flight, we're not getting into that deep sleep, we're not digesting our food. So I think that is probably the biggest thing that we start with in our office is consistent chiropractic care to work on the parasympathetic system, working on sleep-wake cycle. Are you matching your eyes to the sunlight? Are you sitting in that circadian rhythm? Are you slowing down, actually eating your food, eating it with joy, with abundance, with family, friends at a kitchen table, not at the couch or not on the go in the car? So I think those are things that like when we have these women coming in, they're like, I'm bloated or I'm constipated, like going back to those lifestyle approaches. When I first started practice, we did a lot of food sensitivity testing like right away off the bat. And I've come to find that those food sensitivities are probably the last thing that I check now. Yes, they relieve symptoms if we eliminate the trigger, but we're not actually fixing the cause. So really getting into parasites, candida overgrowth, small intestinal bacteria overgrowth, working on eliminating the disruptors, healing the gut lining, getting the body into parasympathetic state, and then checking to see if maybe any of the foods are just adding fuel to the fire. So I feel like we have a really good system for this. But again, if we're using the nervous system as our indicator, healing the gut does take time because life happens. Your kids get sick. You guys go to the beach with friends and family and you eat out, alcohol, chaos at work. And so it's just a constant monitoring system.
Yeah. Yeah, I agree. So life does happen and the gut can kind of ebb and flow, right? So like we can get things in check and then something goes awry and we have something stressful happen in our life. And what happens in that time frame is that stress hormone increases, your stomach acid lowers, you struggle to digest and bring in the nutrients that you're eating, and then that can cause those imbalances that Carlee was talking about, like that SIBO, that overgrowth. And so then it's more about rebalancing, getting things like those microbes in check because we have the good, the bad, we just want them in balance. And so the food sensitivity testing, not my first thing to go to either. There's not a test out there that is 100% accurate. That's what I tell people. There's one that I like. It's expensive. It's not the first thing I'm going to go to. A good elimination diet can actually tell us a lot when we know things are inflammatory, like gluten, dairy, corn, soy, sugar. So we work on the nutrition piece. Maybe we don't remove all of those at one time, or we just kind of keep a reference of like how our body feels in response to things. And then we work on that and we work on healing the gut in that way. But I just think that, when we have if somebody takes a food sensitivity test and they're responding to all these things, that's just a deeper underlying issue of like, okay, well, we need to like heal the gut because clearly your system is just overloaded and responding to things that it typically wouldn't respond to. So it's not my first go-to either.
Cool. What about IBS? What are our thoughts on IBS?
Well, I IBS is a general term that really doesn't tell us anything. It's how I feel about IBS. And I say that from a personal perspective. I was 18 years old. I ended up in the ER with severe abdominal pain. My mom didn't know what was going on. Um, and I left there with a diagnosis of IBS. Nothing, I didn't know what to do with it. I was just like, oh, you have IBS. Here's a medication to stop the cramping. And so I went on this journey of like, oh, fried foods trigger it. Cream, like heavy cream, dairy triggers it. So like I figured my triggers and like how to avoid that. Now, do I still struggle with stuff? Yeah. I mean, I eat out. I so it's like there's things that can kind of rear their ugly head, but IBS is just a term of like, hey, we don't want to take the time to figure out what's triggering your symptoms. And so we're just going to say you have IBS and give you a medication to try to control it.
And if that's something that people don't know, that is so pretty much anything in the medical community that ends in like a syndrome is there's a list of supplements of symptoms that as long as you have three or more of those symptoms, they can diagnose you with that condition. And so it's just a broad term for a group of symptoms. And I think that's where Tiffany and I come from the same place of like, we want to figure out like, why are those symptoms presenting themselves?
I'm gonna just throw in there another one that drives me crazy personally is the fibromyalgia diagnosis. Just a list of symptoms. Okay, as far as supplements go, I know we all experience everybody's bringing in bags of supplements. They're all over Instagram, they're all over Amazon. Um, how do you decide when to give a supplement versus when to try to get it from food or you know, seeds are a big one right now. Your nuts, all those have, are really great vitamins and minerals. How do we decide supplement, food, or I guess Tiffany, in your case, like a medication?
I think it's a yes and I don't think it's like there's a study and I'd have to find it where they measure the amount of vitamins in an apple in like 95, 2005 and then 2025 and you would have to have 5 apples in 2025 to reach the same amount of nutrients that you had in one apple in 95. So I do see a time and a place now where unless you're growing every single thing you eat, your food is getting not as nutrient dense as it once was. Now, I do think there's still great sources. I think we can source things really well and we can find foods that are high in the nutrition we need. But I think, especially when we're trying to achieve a goal quicker, like supplements at higher doses are going to help us get there. So in our office, we muscle test which supplement, when to take it, how many to take of it. I think this is something that I'm really passionate about because let's say Tiffany does a blood test and someone needs methylation support, like a B vitamin that might work for me, might work for Dr. Lydia, might work for Tiffany, or might work for my husband. We might all need a different B vitamin and at a different dosage. So I think I get really passionate about using the right supplements at the right time, at the right dose. Definitely don't buy it. If an influencer's talking about it, it's probably not that great. So don't buy it off social media. Amazon, some of the companies we know, like, and trust do sell on Amazon. We just have no guarantee to know that that supplement you're getting from Amazon has been well taken care of. I mean, I see people, driving in their Toyota Priuses with no AC with my Amazon package. I'm not sure if I want my probiotics sitting in that hot car all day. So whenever possible, I would say you want to get it from a provider. And if you don't know this about supplements, like Tiffany, myself, Dr. Lydia, we have to show our license to be able to get some of these pharmaceutical grade supplements. And that just means that they're checked for purity and potency. You can't just get them at Whole Foods. So, we just want to make sure that when it says on the bottle you're getting something, you're actually getting that every single time. So I would say I get a little bit more picky about supplements, but I do think they're necessary.
Yeah, yeah. So I agree. Our soil just isn't the same. The things that we're growing our food in isn't the same. It's depleted. And so sure, yeah, you can grow your own things and you can get more nutrient dense foods from that or like the local farmers market, but even then we still the soil is not the same as it used to be. Um, so I think that there is a time and a place, and so I test. I look at micronutrient status. I want to look at the red blood cell markers of those nutrients, which gives me a more broad idea of, 2 to 3 month picture of what your body's doing. Are those nutrients getting into the cells? And if we're depleted, we work on repairing that through food and also with supplementation, especially if somebody's really low and we really need to kind of support their system quickly. Um, but the supplement companies, I like, they third party test their products. We make sure that they're doing the right things and that you're getting what you're actually paying for and that they're effective and over time. And I'm sure Dr. Carlee can see this too, is that we know that they work because we've seen them work in people. And so we know that you're kind of getting what you're paying for. And the Amazon thing is the companies, some of the companies will sell their products on Amazon. So I say like, hey, to her point with the hot car and all this stuff, but like if you're getting something off Amazon, you really want to make sure you're getting it from the company. And so it's just a little more complex, but yeah, I think supplements when given at the right time and can be useful.
Agreed. I always say if you're going to order from a supplement company on Amazon, make sure it's that company and not a third party. Because I ordered salt one time and it came opened. So that got pitched. All right, let's shift to chronic fatigue. All right, I was gonna say moms are always tired, but it's seeming to be everybody now. We're all exhausted. We're all hyper focusing on caffeine, and we've got the Celsius is out there now. So let's talk about the difference between a lifestyle fatigue and something possibly going deeper, maybe to a cellular level. I'll have you start, Tiffany.
Okay. So yeah, I see it a lot. Like people are struggling with fatigue, they're burnout, and is it a lifestyle burnout or is there something going on internally that's causing this right at the cellular level? And so um that's why I test. Like the muscle testing is one way of testing, but I look at nutrient status and blood work can kind of cue me into like, oh, maybe there is some mycotoxin illness going on or all heavy metals or something that could be triggering the body to cause what the mitochondria, which creates energy, to malfunction. And so then we have to go after that substance and fix that. And then we can kind of come back around and repair the mitochondria so your body can efficiently make energy again. And so what can happen too over time is like if your body is stressed, like your thyroid function is going to decline. Well, we need thyroid for energy and metabolism and all the things. And so we have to figure out what that stressor, crap food, toxins, I tell people we have to like figure those things out and work on them. Now, will I support the body if it needs a little thyroid hormone while we're trying to figure out the other stuff? Yes. Will I give it nutrients that might be really low? Yes. So it's like we support and we shift. But the fatigue is a big one. And if we're not like managing our stress, if we're not I tell people like getting outside, just getting outside, getting fresh air, getting sunlight, those things, like it's just going to amplify that, getting that we need exercise. But the appropriate exercise and when we need it. So it's whole picture, always looking at the whole picture.
Yeah, I think the key word that you said that like I look at in clinic is like that mitochondrial dysfunction. And we talk a lot. I see a couple people on here with like their red light glasses. Like we are in stimulation central right now between like ease of access with Apple Watches, iPhones, like stimulation from screens, internet, Wi-Fi, all of that. And so I'm a big component of circadian rhythm, matching your eyes to the sunlight. Other than these webinars, limiting the amount of blue light that you get when the sun sets, is huge for us. In our house, we also do a lot with like EMF exposure just to decrease that pressure on the mitochondria. And then I use a lot of supplementation with just, like you said, those micronutrients that the body needs to create more ATP, and then the minerals that the thyroid needs to just create more of that energetic function. But kind of like Lydia said earlier, like chronic fatigue or any of those, like, again, we're just placing a label on a symptom. Let's figure out why the symptom is there to begin with. And it usually stems from that mitochondrial function or that thyroid function.
Well, I have a question here. How does cortisol fit into all of this? How do our adrenal glands, our adrenal fatigue? I know that's another big like hot topic. And then I mean leading all the way into like the cortisol belly. Everybody's asking, how do I get my cortisol down?
Go ahead, Carlee.
Well, I'm
Carly.
like, stop stressing out. Like, like it's that simple. No, it's not that simple, but yeah, exactly, right? So like cortisol should be highest in the morning and then it should like come down throughout the day. We're seeing some patients that are coming in and they've had a saliva cortisol test or a blood cortisol test in the morning and it's sky high right away in the morning. Or we have some that are low throughout the day. So cortisol is there as a motivator and it's supposed to be there. So I don't want to give it too much of a bad rap. And Tiffany, you can speak to this too, but like it has purpose. So, but if we are not giving it the right nutrients, if we're not matching our eyes to the sunlight, if we don't have the circadian rhythm and your cortisol is spiking at 2 p.m., we could see how the body would not have the proper energy throughout the day. Or we see a lot in our office that, oh, well, I was super tired at 4 o'clock, but I had to get the kids to bed and make dinner. And then all of a sudden they get an adrenaline rush. So I think it's also just listening to your body cues of like, when you're energetic, that's when you should be doing things. When your body is calming down, allow it to calm down. There's a lot of great supplements and herbs to support this, but like your body doesn't just like run out of cortisol. Like I don't, it runs out of the nutrients to produce cortisol. So I get a little bit touchy when it comes to the verbiage that is used in a traditional medical system.
Yeah, I mean, I think that that's a big buzz thing right now, like cortisol, 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 and we hear so much of it on social media. And yes, it is a very important hormone, and it is there to support us. We need it. If we don't have it, it's a big issue. But it just takes me back to like, what are we doing in our lifestyle, and what can we change in order to support our stress response and minimize. We want cortisol to respond when we want it to respond. We just don't want it to get completely off balance. And so again, it's just everything is about balance. And so it just working on regulating that system. And yeah, there's adaptogenic herbs and there's nutrients and things that you can add in, but I tell people deep breathe for 2 minutes twice a day. Take some deep breaths, like some box breathing. This is something that costs you nothing, and it can really reset some of that, bringing in that like that calm response. But the lifestyle is still, always going to be really important there.
Okay. What about mental health? That's another big woo thing going on in the world right now. Is it gut related? Is it stress related? Is it lifestyle related? What are your takes? Let's go, Tiffany, you go first.
Oh gosh, I think mental health is really complex. So it can be so many different things. So we're seeing people that are again just stressed in general for the day-to-day hustle and bustle of everything. Then we're seeing like toxins in our environment that are stressing the body, which then in turn can cause, I mean, I've seen mold, like mycotoxins, like really cause some pretty severe depression and anxiety in individuals. And then that mycotoxin will cause hormonal shifts. So it's just we really have to look at the whole person. And do we even have the nutrients needed to make serotonin, which majority of that is made in our gut, and we need B6 and we need all these vitamins. And if we don't have these nutrients needed to make these neurotransmitters, like we're going to see mood fluctuations and anxiety and all the things. And so um, I don't think it's just a one thing. And I always like support, hey, we have talk therapy here. What are we doing to support our nervous system at home? What do we need to replete and balance? And so I love a therapist. And so I just think that it really depends on the individual and what's going on with them.
Yeah,
I couldn't live without mine.
I definitely think the gut is a huge component, and that goes hand in hand with like the toxins. I just think of like how toxic some of our food is, especially if we're eating out, high soy-based diets, MSG, those things. I know in our house, like if either of us eat MSG, like right away we start getting anxiety. So, I'd say the gut is huge because of where, like you said, all of those happy hormones are made. But on the other side of that, like leaky gut, again, a buzzword, but like if you're not absorbing all those micro and macronutrients in the gut lining, you don't have the building blocks to make all of those happy-go-lucky hormones. So, plus we have hormone disruptors. So I do think, like you said, the toxic burden is huge. Parabens, phthalates, molds, those things constantly being integrated into the body is going to disrupt our ability to make the things that are good for us in the right amounts inside of our body. And then my last one is as simple as sunlight. Um, they've done more and more studies about like, I think it's like an adult should have 3 hours a day of sunlight. Whether it's standing outside, whether it's on your eyes, and this is not through a window. And I don't know if any of you with just work jobs, like there is days where like my only time outside is the 3 minutes to walk to my car, the 3 minutes to walk back inside the house. But I think that's probably the most underlooked one is just making sure that you have enough vitamin D and enough sunlight um, every day.
Sweet. I can attest to that personally. Those rainy days in June. Ooh, that'll get you that seasonal depression. Okay, let's shift into like let's touch on just quickly fertility and pregnancy. So on the front end, man, is it hard to get pregnant these days? I know you both are seeing this a ton. So how do we get there? How do we stay there? And then I kind of, one of those main culprits, what are the things that you're like those big things that people need to change about their lifestyle? And how do you approach this? I'll have Carlee go first.
Yeah, I would say the number one thing I see with fertility is stress. Like I said, those precursors, the things that are making your cortisol and the same things that are making your sex hormone. So if you're producing a lot more stress hormone instead of some of the sex hormones, we're going to see just changes in the hormonal cycle. Um, I would also say the other thing with that, and Tiffany, I don't know if you have any perspective on that, is just like the men's health, and making sure that it is not just the woman's job to get pregnant, but that we have healthy moms and healthy dads to make healthy babies. And I would say we're not getting men checked early enough. And making sure that their macro and micronutrients are in the right order so that they're producing enough testosterone, having healthy swimmers, all of those things. I would say with most of the fertility patients that come into our office, we spend a good 90 days just on detoxing, cleansing out the system, just getting rid of any of those hormone disruptors that could potentially be inside of the body. And then I prefer a good 90 days of increasing nutrient density before they even try to conceive. So that is always my goal. If a woman is on birth control, my goal would be that they're off of birth control for at least 6 months before they try. But my goal would be at least a year to get all the toxins out and get all of the nutrients up to make sure that those sex hormones are in the proper balance.
Yeah. Um, that is a good point on the male. I will say that I see some younger males and I'll see testosterone levels that are in the dump. And I'm just like, wow, you're 21 years old and your testosterone is barely there. That we shouldn't be seeing that. And and just with fixing lifestyle alone and within 3 to 4 months, I've seen these levels really like double, almost triple. And so that's why I tell that's and then they see that and they're like, "Oh my gosh, yeah, this is actually really important." And but as far as the females, I have worked with some women and infertility, and they've gone to fertility docs and they've been trying for a long time. And so we look at a comprehensive panel. We see like what's going on. What is your thyroid function? Because thyroid is so important for getting pregnant. And then we look at different nutrient depletions, and so we work on repairing that and see if there's something there that's kind of blocking their ability to absorb like the gut and those nutrients that they need in order to make thyroid hormone and other hormones. And so really again, just kind of looking at the whole picture. And I, because I do prescribe some women, I will give them thyroid hormone, and I have had them get pregnant based on thyroid hormone and other things that were malfunctioning. And so it really just it depends on the individual, but yeah, just making sure prepping the body and making sure the body is ready to go through that. So sometimes that takes time.
Tiffany, would you argue that the way you treat someone with fertility and the way you treat somebody else isn't that different, right? Like, or at least like in
Yeah.
my, like, I'm like, I'm getting you well, like, right? Whether you're trying to make a baby or you're just trying to go to the beach next week, like, function of health and nutrient density is important no matter what.
Correct. I feel like I approach it. I mean, I might look for different things in lab work and stuff just to kind of see if something is underlying there that we would see sometimes off in infertility issues and stuff, but I address it the same way. Like we're gonna take a holistic approach to the care no matter what, and we're gonna work on fixing and repairing those things.
Sweet. I love that. Well, or what'd you say, Carlee? Healthy moms make healthy babies. So it's just treating the human. Okay, let's talk quick about postpartum. So this whole big bounce back, I mean, that's been something that has been in our culture for years. So what's really going on in the body postpartum? Let's talk trimester four. Tiffany, go ahead.
Yeah, so postpartum, we're just seeing we're seeing a significant shift in progesterone. A progesterone drops, and then we start to see these really big hormonal shifts, and then there your body is, and you're working. If people are breastfeeding, and not everybody is, we're working to feed a child, and so a lot of the times we're not getting the sleep we need, we're not getting adequate nutrition, and so then we're seeing our health kind of go crazy, or not be where we need it to be, or we're seeing the postpartum anxiety and the postpartum depression. And in that period, it's so hard for women. I've had multiple women come to me and they're just like, I don't know, my OB wants to put me on an antidepressant. And for me, it's like, well, what's going on? Like your progesterone just dropped. So like let's support that and give your body to heal and regulate. And even after people stop breastfeeding, it could take 12 months for their hormones to fully regulate. So this like bounce back idea is not a realistic expectation, but also I empathize because I know what that feels like to have severe postpartum anxiety and how impactful it can be on your life and how you could feel like I'm not being the best parent I can be. I've been there and I was not treated properly for it. And so now looking back, I'm like, okay, I've experienced that. I know how dire it can feel. And so just kind of working with these women to make sure they're getting the right protein and the nutrients they need. And can they get some help, like if they're getting really disrupted sleep, because of course that's what we're going to have when we have a newborn. So just working on all of those things and just trying to help them through that. But yeah, in supporting the hormonal shifts when needed.
Yeah, I would agree with that. There was something that I was reading and it was basically saying like it takes 18 months to fully heal from a pregnancy. And so I even look at some of these women who are coming into the clinic and they're getting pregnant, 9 months, a year after they just had a child and very nutrient depleted. We also like I love looking into like some of like the Chinese like herbs and even just like old Chinese culture of like making sure we are using warm foods, bone broths, decreasing the sympathetic response, calming the body down postpartum, and just increasing the nutrient density as much as you can to heal. I also think there's a lot of great herbs that can come and support in that. And I love using those as just a safer option for those breastfeeding moms than maybe using some of the pharmaceuticals that are out there that maybe you don't want to get through breastfeeding. So, but all the same things.
Okay.
Time.
Other than those herbs, like just providing more minerals, more nutrients, is there an argument for providing progesterone when we do have that dip? Or is that more along the lines of the body's natural response, something that's supposed to happen? Um, any
Yeah.
thoughts there?
Yeah, I think it really depends on how severe the individual is feeling. Like I will support with progesterone for a period of time if needed. And I have found that it has kept women off of the SSRIs, like the antidepressant medications.
Okay.
Um, and quite honestly, I had somebody recently who I literally was like, I'm gonna go to her house to check on her because I felt like she was very in a not great place after having a child. And she just didn't want to go on the antidepressant medication. And here I'm not anti-medication, as you clearly know. Um, and so I feel like if you need something, you need something, and that's okay. Um, but we supported with progesterone and she was able to get beyond that. Like she was finally able after 4 months to like get in the car with the baby and take the baby somewhere. And so it's just like we just have to kind of meet people where they're at and then we'll reel that back and get rid of it at some point. But just right now, uh she needed some support.
Cool. Carly, any thoughts to
No.
add? Okay. All right. So I want everybody to know we're gonna probably just ask a few more questions here. So if you have any thoughts you want to add to the chat so that we can get them answered before we end, you can do that. If you're on a phone, it is kind of tough. So click your screen, hit the chat, and then you can type it in there. I personally know my mom is struggling with that right now. So next question. What is something you know is going to frustrate a patient along this journey? What's going to predict their results? How do you know if somebody's going to succeed?
I think the biggest thing is you have to communicate to the patient the timeline. And really when it comes to holistic healing, like the timeline could be as short or as long as you want it to be. I have patients who, they go all in, and when we recommend lifestyle changes, they make all of them the next day, and we do see faster results. But life is always variable. Like you're going to have trips, you're going to lose your job, you're going to have a death in the family, whatever it might be. And so because of that, it's the timeline. And so how it works with one person versus the next, we don't know. So all we can do is give best estimates based off the patients that we've already seen and how much time it took them to get better. And just we want to just communicate as clearly about that as we know how to. Um, but I would argue that, if you go all in, we do tend to see faster results than those that still have that like one foot out mentality. And you can hear that in their voice. And if that's somebody who's coming in and they're like, well, I can really do this, but I don't want to do that, um, we just stretch the timeline out. And that's totally fine.
Yeah, I think timeline is important. I think it's important to give ourselves grace as well, because everybody is in a different place in their life and everybody has different things that's impacting their ability to make changes, whether that's a financial thing, whether that's a family thing, whatever that means for that individual. And so I think it can be challenging to do all things at one time, but also people, to Carly's point, if they can do that, those lifestyle things, yeah, we do see people turn around quicker. Um, but I also tell people it's okay to just implement little changes at a time that's manageable for your lifestyle, because if you get overwhelmed by the 50 things, you're not going to do any of it. And so it's just about that balance and trying to help people be successful where they're at.
Agreed. I have some people I'm like, let's one step at a time, one day at a time, try to make a hierarchy of what's most important today that you can change, make a habit of for the next 3 weeks, and then we'll add the next step. So, um, all right. How has your treatment approach evolved since you first started? So, kind of give me like a timeline of how long you've been in practice and kind of where you're at now, some of those aha moments you've had along the way.
Uh, well, okay. So I guess I've been a nurse practitioner for almost 10 years now. And I was very traditional, started out in house call primary care, and then I kind of lived in oncology, hospice palliative for a long time. And it wasn't until about 5 years ago when I was working in oncology here, a mentor of mine was like, "Hey, you seem very, I have a degree in exercise sports science prior to nursing. And so they're like, you seem very into health and wellness. You should look into this." So about 5 years ago, I went through this fellowship to learn all things functional medicine and stuff. And then I went through a cancer program for integrative oncology. Um, but I it's a different world. So from where how I was trained in nurse practitioner school was, here's symptoms and here's the medicine you give to fix it. Versus now I'm like looking at the cellular level and what is going on that's potentially causing malfunction, and how do we repair that with lifestyle, supplement, nutrition, all the things. And honestly, like I every day my husband likes to make like be like, can you just turn it off for a second? Because I'm always listening to something new. I'm always trying to learn something or researching something. Um, I just think my practice has evolved, but I'm always learning. And I think that that's important, because I think the second we stop learning, that's when we stop helping. And so I just can try to continue to evolve. And I learn from Carlee, and I learn from whoever will be willing to teach.
Yeah, I would agree with that. I think sometimes it feels when you're in 2025 and in the world of healthcare, like it's like drinking from a fire hose every single day. Whether, like you said, books, podcasts. I mean, I think I should have looked at books on Amazon Prime Day today to see if any of the ones I wanted were on sale, because it's just like they're constantly showing up at the door.
You
Um,
gotta send it.
yes. But I think it's just like, I think my biggest, so I've been in practice now, I'm in year 9, as being a chiropractor, and I've been doing muscle testing and the nutritional stuff since the very beginning. I would actually say, I think over my 9 years, I've gotten more aggressive. I think at the beginning, I was probably dabbling a little bit more into like, hey, let's try this, let's do this, like really ease into the patient. But so many people now are seeking health, and they're seeking it from a natural perspective, and they are eager and they are ready. And so one of my biggest things is like really just giving it all to them and allowing them to decide like, hey, what can I do and what can I do right now, and how do I add these layers in? So I definitely do probably more now than I even did 9 years ago. And that kind of sounds similar to you, Tiffany. But I'm with you. It's just like we're constantly learning. One thing about like as chiropractors, we're required to do continuing education. For the state of Tennessee, we have to do 12 hours every year. And we go to seminars all the time, and none of them are even counted for continuing education, because all of this stuff that we have passions in when it comes to holistic health and nutrition and lifestyle, that's not the stuff that the state deems as necessary for maintaining our license. So that's just something that we have huge passion for. We take our staff to, always seeking that just extra education. And I think the last thing is just like, there is no shortcuts. I know we all know that. And like you've heard Tiffany and I this whole conversation talk about like lifestyle. Like, are you eating all the right things? Are you doing all the right things? Like, we can't out supplement a bad lifestyle. And I think I have those honest questions or those honest conversations more and more every single day now than I ever have.
Yeah, I think I was listening to a lecture from Dr. Nasha Winters the other day. She's the one that I went through her metabolic approach to cancer training program. And she basically said, look, if somebody is coming to you with an active cancer and they're not willing to make nutritional changes in their lifestyle, like they're not your patient, because you have to do those things in order to heal the terrain. So it's that serious, especially when we're talking cancer that's already present.
Awesome. Thank you. Okay, couple little like rapid fire questions here. Dairy, good, bad, in moderation. What do we think? Tiffany, go.
Yeah, so I think, I mean, okay, so dairy can be inflammatory. Some people can struggle to break down the protein. Not everybody does. Where are you getting your dairy? Is it organic? Does it have hormones in it? Does it have antibiotics in it? So I think it depends on the dairy and where it's coming from and the source. So it really just depends on the individual and the source of where you're getting it. And I wouldn't say eat dairy all day, every day, but it depends on the quality too.
Cool.
Ditto.
Sweet. Next, intermittent fasting for women specifically.
I think there's an age threshold. I think for women over a certain age, I think it's a beautiful thing that can be really helpful. For my menstruating females or my women who are in the age of trying to conceive, I don't usually recommend it because I feel like it increases cortisol too much.
And I think time frame, if you're doing it, especially in that population, I would say like the eating first thing in the morning with a protein and a healthy breakfast is important. If you're cutting it off earlier at night because you're doing some intermittent fasting, fine. But like I usually say, don't wait till noon to eat.
Cool. I'm on board with that. What about genetic testing? When do we do it? When is it worth it? At what point do we call that in?
I've had
Yeah,
Tiffany, you.
go ahead.
I've had a lot more women do it, like on their babies, like in the first 1 to 2 years of life. It's really interesting. I don't think it's necessary, but I think it's really interesting to kind of see like what's going on in your child's genetics, but I don't think it's the whole picture at all.
Yeah, so I mean, hey, I've swapped my all my children. But I think it's our genes are our genes. And so it's what in our environment certain genes, if we have two copies or one copy, two copies can cause us to be more prone for something going wrong, but that doesn't mean something's going wrong. So it really is like it gives us information. And if something is going awry, we can look at it and say, "Ooh, is this what's going on?" And then we can support it. But it's our environment that impacts those genes from causing issues. Like that's our epigenetics. And so is it completely necessary? No, it just provides information.
Oh, I like information. I like to know. More I know, the more I feel like I can help other people. So, what about chiropractic care during pregnancy? Carly, you can take this one away.
100%. There's so much research out. Decreases labor times, optimizes the pelvis for proper birth. 10 out of 10, 20 out of 10. Best answer.
Great, I agree. Any thoughts, Tiff?
I mean, I'm gonna agree.
You can't not. All right, last question for you guys. As far as collaboration goes, when do you refer a patient to each other? Are there any cases you prefer to combine approaches? I know we've kind of touched a lot on this, like Carly going when we're going back and forth, but give me something like specific, or when should somebody or a listener on here utilize both? What time do they go to either one?
Yeah, I honestly think it could be at any time because what I have found with Carlee is she'll send people to me and we've been working together for a minute. She's been seeing them, I've been seeing them, and I'll see something off on their labs and I'll be like, "Oh man, I just don't think you're really like methylating well or something." And she'll say, "Oh, Carlee took this down already on me." Like whatever. So there's things that correlate is what I'm saying. And so, so I think that it can be a good combination at any time. Um, because, of course, I do the lab testing and then Carlee does the muscle testing and we can kind of play and we never like we work together in that regard, like with what's going on with the person. But I think it can be any time, to be honest. I don't know if I have an exact specific example, but
No, and I think
That's
overall,
perfect.
like what Tiffany and I have been saying this whole time is right. Like it's a combination of the lifestyle stuff with the biochemical stuff and with chiropractic being so nervous system focused. Like I think they go hand in hand if you're looking for wellness, having a chiropractor and having a nurse practitioner who cares about your body functionally. I would also say, and this is not to like toot our own horns, but like Tiffany and I both like deeply care about every single patient that we see. And I think that like if patients could see the voice memos and the text threads that the two of us have at the end of the day, driving home from our respected like offices of being like, oh, I saw this person today and I tested these things. And she's like, oh, I saw these things. We tweaked this. Hey, can you muscle test this next time? Like we are very passionate about all of you on the that are on here and just like all of our people. And so it's just the benefit of having two doctors plus like we have Dr. Lydia like that can come in and just help take care of your health.
Awesome. Okay, before we wrap this up, we've talked so much about lifestyle, and it feels like a big sandwich to bite into. And everybody's like, okay, where do I start? If I wake up tomorrow morning with one, two, or three things, let's go three things that are the most important for like how we are going to shift into this lifestyle change tomorrow. Where do we start? And Carly, you first.
Okay, so my three are always 100 grams of protein a day, 100 ounces of water a day, and match your eyes to the sunlight. So matching your eyes to your sunlight means no screens, no bright lights when the sun sets, which right now is around 8:30, as you can see behind me. And then it's waking up to the sunlight. So 5:30 a.m., you get outside and you put the sun directly on your eyes. So 100 grams of protein, 100 ounces of water, match your eyes to the sunlight.
Oh,
Yeah, good ones. So I am gonna say, oh, hello?
You're still there.
we
Oh
we
my
see.
gosh, I'm sorry. It said it like cut out, and I was like, what happened? Okay. Um, so I'm gonna say that if we're not sleeping well, we gotta fix it. And that just means sleep hygiene to me. So that means like, okay, you have a little bedtime routine, and if that bedtime routine is something as simple as I'm going to soak my feet in an Epsom salt bath or take an Epsom salt bath, or I'm just going to put a little lavender essential oil next to my bed and wash my face. It can be something just so simple like that, but like this shutting down the screens and doing that little routine can really set your mind up to like, oh, it's time to go to bed. And so just getting into a good sleep hygiene routine. And then I do think consistency as far as waking up and watching the sunrise is important. And also, I tell people pooping, like if you're not pooping, we got to fix that.
Yep.
And so we'll work on that with fiber and nutrition and all the things. So
That's great. All right. We're gonna sleep, we're gonna poop, we're gonna drink water, and we're gonna eat our protein, and we're all gonna live happy and healthier lives. So thank you all for joining. If anybody wants to add anything in, that's all I've got. Thank you guys for answering all my questions and just making the world a better place.